Hello everyone, this is Prayas and today we're going to discuss about drugs acting on uterus. Okay, so the drugs acting on uterus is one of the most important topics for your exams because in your prof or in your term exams, a question from this is almost guaranteed, I don't know the spelling of guaranteed to come. Right, so it's almost as if it's almost guaranteed to come in your exams, so it's really important. So that is what we're going to do today. We're going to go over the main drugs acting on uterus, and I will also discuss how the question comes in your exams as well. So these are all prof questions. So as you can see, I have a lot of notes on prof and term exams. These are all prof questions, right? So this is a prof question, right? These are all prof questions. So as you can see, there are so many questions from this topic that come in your prof, and if something comes in your prof, there's a high likelihood that it will also come in your term exams as well. So with that being said, let's go right into it, right? So what are the drugs acting on uterus, right? So the question coming here, there's a question like this: enlist the drugs used on a pregnant uterus, right? So the drugs acting on uterus, we can broadly classify them into two types, right? The first one is what we call ecbolic drugs, right? And then the other one is known as tocolytic drugs. So ecbolic drugs are also known as uterine stimulants, right? So by their name, we can guess that ecbolic drugs are those drugs that contract the uterus, right? So these drugs, they cause uterine contraction, right? As opposed to ecbolic drugs, there are another type of drugs known as tocolytic drugs, right? So these tocolytic drugs are opposite of ecbolic drugs. These are drugs that relax your uterus, right? So these drugs, they relax, I don't know how to draw relax, they relax your uterus. So broadly speaking, you can divide the drugs acting on uterus on two types. One is ecbolic drug, other one is tocolytic drug. So the major ecbolic drugs that you need to study about is oxytocin, ergometrin and prostaglandins, right? So these are the three major drugs that we use to contract the uterus, right? And there are other drugs such as quinine, and I don't know what this is, you don't need to remember. If they ask you in exam what are the ecbolic drugs, you just say three names, okay? One is oxytocin, ergometrin and prostaglandin, right? And then the tocolytic, so these three drugs, oxytocin, ergometrin and prostaglandin, what do? They contract the uterus, right? Now, as opposed to, then these are collectively called ecbolic drugs. So as opposed to ecbolic drugs, there are tocolytic drugs. These relax the uterus, hence they are called uterine relaxants. So there are a lot of different drugs in this category. Adrenergic agonists, like beta 2 agonist, if you remember that beta 2 receptors are present, their function was relaxation of smooth muscle, right? So uterus also has a lot of smooth muscle, so when you stimulate the beta 2 receptors, the uterus relaxes. So beta 2 agonists such as salbutamol, ritodrin, torbitalin, so these are a type of tocolytic drugs. These drugs relax the uterus, right? We also have calcium channel blockers, oxytocin antagonists. Why oxytocin antagonists? Because I mean it's common sense, right? Because we said that oxytocin causes uterine contraction. So if you antagonize or block the action of oxytocin with a drug called atosiban, then if you block the thing that is contracting the uterus, what will happen? It will relax. So oxytocin antagonists are also tocolytic drugs. They help relax the uterus, and other drugs such as progesterone nitrates. So just remember a couple of these. For exam point of view, the uterine stimulants or ecbolic drugs are way more important than the tocolytic drugs, right? So in this video, we're only going to concern ourselves with ecbolic drugs. So let's go deeper into it, right? So this is a really nice note that I made from, I don't know, different sources, from lecture slides, lecture classes, what teachers said, as well as Triparty and other books. So this is the main question that comes in your exam, and this question came in our prof as well. So I gave prof in 2023, right? 2023 prof, right? So the question that comes in your exam, which will probably come in your exam as well, is what is the difference or compare between oxytocin, ergometrin and prostaglandin as uterine stimulant. So we just studied that all three of them, these three drugs, they are ecbolic drugs, right? But they have certain very important differences, right? So there's a question that comes in your exam like compare between oxytocin or ergometrin, oxytocin versus ergometrin, or it could be oxytocin versus prostaglandin, right? So any combination of these questions. So in order to write this answer properly, you need to understand the basic characteristics of each of these drugs, right? So at first we'll talk about oxytocin, right? So oxytocin, what is oxytocin? From your, I don't know, physiology knowledge, oxytocin is a hormone, right? And where does it come from? It comes from the posterior pituitary gland, right? Am I right? Yeah, posterior pituitary gland. So there's your hypothalamus in your brain, and then there's this thing which looks like testicles, but it is not testicles. I'm sorry, okay. So this is the anterior pituitary gland, and this is the posterior pituitary gland, right? This is your hypothalamus. So from the posterior pituitary gland, two hormones come out. One is oxytocin, right? Oxytocin, and then the other one is ADH, right? So oxytocin is what? A hormone, right? It's a hormone. It's a neuropeptide. Because why is it called neuropeptide? It's a peptide because this oxytocin hormone is made out of. So this oxytocin hormone is made out of protein. So that's where the peptide name comes from, and it's released by the neurons, right? So you know that the posterior pituitary has these nerves. Okay, I'll draw it in another color. Hold on. So the posterior pituitary has these nerves that come from the hypothalamus, and these nerves directly release these hormones, right? So oxytocin, since it is directly released by the nerves coming from the hypothalamus, it is called neuropeptide, right? Neuro because it is released from the nerves, and peptide is because it's made out of amino acids, peptides, right? Another name they might ask you in Viva, another name of oxytocin, it is also known as nonapeptide, right? Right, okay. it might be it's something to do with nonapeptide, right? So it's also called nonapeptide. Correct me if I'm wrong, because I might have forgotten it. So it's also called what? Nonapeptide. This is important for your Viva exams, right? Why is it called nonapeptide? Nona means, 9, right? So nona means 9. So when you look at the structure of oxytocin, if you look at it, it has 9 peptides connected. That's why it is also known as nona, means 9, and peptide, right? I mean, they ask this in Viva sometimes. That's why I'm telling you this, right? So oxytocin is what? It is a hormone. It is a neuropeptide, right? Now, with that out of the way, we will talk about the important stuff, right? So what's important? The type of contraction. So we all know that oxytocin, prostaglandin, and ergometrin, all of these are uterine ecbolic drugs. They contract the uterus, but the type, in the manner in which they contract the uterus are different, right? So the type of contraction that oxytocin does is a clonic type of contraction, in which the contraction is followed by, the contraction is followed by relaxation, right? So when you give oxytocin, there are 2 types of contractions, okay, very briefly. One is a clonic type of contraction, other one is a tonic type of contraction, right? So what's the basic difference between the two? Clonic type of contraction basically means that there is contraction followed by, contraction followed by relaxation, right? So in clonic contraction, the uterus contracts and relaxes, right? As opposed to clonic type of contraction, in tonic type of contraction, the uterus just contracts. The contraction is not followed by relaxation. So like this, contraction, relaxation, this is clonic, right? Because the contraction is followed by relaxation. But if the uterus is only contracted, right, it's like spasm, contraction only, this is known as tonic type of contraction. So why is clonic type of contraction required? Clonic type of contraction is required if you want to push something out of the uterus, right? For example, what is usually pushed out of the uterus? I mean, the baby, right, during pregnancy. So whenever there's normal labor happening, and whenever you want to push the baby out from the uterus, what the uterus has to do is, so here's your baby, right? So it has to contract, right? Contract, so the baby goes down, and you have to relax so that the baby can get space again to go down, and then contract again. So it's like pushing, relaxing, so that the baby can go forward, again pushing. It's like the peristalsis movement that you see in your intestines, right? It's pushing and relaxing, so that the baby actually moves forwards, right? So clonic type of contraction happens. It is a type of contraction in which contraction is followed by relaxation. And why is it important? Because if you want to push something out of the uterus, you have to contract and relax the uterus, right? So we studied that oxytocin is the drug that causes clonic type of contraction. So when you give oxytocin, what is the type of contraction in the uterus? Clonic type of contraction, right? And which means the contraction is followed by relaxation. Also, see, in clonic type of contraction, it helps. I told that clonic type of contraction helps to push the baby outside the uterus, right? So this is your uterus, right? The whole thing. This is your uterus. This is your cervix. So this is your cervix. This is the body of the uterus, and this is the freaking fundus of the uterus. This part, right? So if there's a baby here, right? If you want to push this baby outside, it would make sense to contract the body and the fundus, right? If the body and the fundus contracts, but the cervix relaxes, then the baby will be pushed down, and then since the cervix is relaxed, it has path to go outside, right? But instead of this, if all cervix, body, and the fundus, all of them contract at the same time, right? What happened? Hold on. Okay. So instead of this, if the fundus, body, and the cervix, all of them contract at the same time, will the baby be able to go out of the uterus? No, not really, right? Because when the cervix is also contracted along with the body and the fundus, the cervix will make the baby has to go through the cervix, right? So if the cervix is also contracted, then there is no space for the baby to go down. So contraction of cervix is not good for getting the baby outside. So in oxytocin, what it does is, first thing it does clonic type of contraction followed by relaxation. At the same time, it causes contraction of fundus and the body, but relaxation of cervix, right? So the fundus and the body are contracted. So only this part, the fundus and the body would contract, but the cervix itself, it is relaxed, right? So is it going to be more helpful to push the baby out if you give oxytocin? Yes, right? Because in oxytocin, only the fundus and the body are contracted. So there is pressure coming from top, right, to push the baby downward, and at the same time the cervix is relaxed, so that the baby can actually go through the cervix. So all of this, what I'm trying to say is, oxytocin is the hormone that helps to push the baby outside, because it causes clonic type of contraction. At the same time, it causes contraction of only the fundus and the body, keeping the cervix relaxed, so that the baby can actually go out, right? So what is the use then? I've already kind of hinted at the use, right? So uterus, oxytocin helps to push the baby out. So the use, why we use oxytocin in clinical practice, usually in gynae, is for the induction of labor, right? So for example, we know that when you give oxytocin, it increases the uterine contraction in a clonic manner, and in a manner in which that helps the baby to go outside of the uterus, right? So if a mother is having trouble during normal labor, right, if she can't push the baby outside, she doesn't have the strength, she's exhausted, right? So in normal delivery, the mother has to, you've seen in movies, the mother has to bear down. We call it bearing down. The mother has to push, so the uterus, right, to put pressure on the abdomen, so that when the mother pushes the uterus, the baby goes out, right? But in some cases, that's not enough. The uterine contractions are not good enough, or the mother is so exhausted that she does not have enough strength to push the baby out, right? In this case, we can give what? Oxytocin, right? So what will oxytocin do? Along with the mother, oxytocin will, what did we study? Oxytocin will help in doing clonic type of uterine contraction. So when we give oxytocin in such women, it will actually increase the uterine contraction, so that it will help induction in labor, that is, it will help in the labor process, right? So what is the main use of oxytocin? It is used for induction of labor, to help the labor, help push the baby outside, right? So if they ask an exam, what is the use of oxytocin, you just say one thing. I mean, there's one more thing, as you can see, but the main thing is induction of labor. And if they ask how does it help in induction of labor, I've already explained about the clonic type of contraction and only contracting the fundus and body, so that it actually helps push the baby outside. That's why we give oxytocin in induction of labor, right? Now, one more thing that I've mentioned in my notes here is in high doses, the contraction becomes tonic, right? So it can be used in postpartum hemorrhage, right? So before I explain you what postpartum, I got to explain you what postpartum hemorrhage is, right? So this was your uterus, right? And there was this baby here, right? So in normal vaginal delivery, the mother pushes the uterus, right? And the uterus contracts, right? The mother pushes or bears down, as well as the uterus contracts, so that there's increased pressure within the uterine cavity, so the baby comes out. So say the baby is now delivered. So this is a baby, right? So after the baby is delivered, there are two things that need to be delivered, right? First is the baby. The other thing is the baby has this umbilical cord, right? And the umbilical cord is then connected to the uterine valve with this structure. So this is the umbilical cord, right? And this is the umbilical cord, and it's connected to the uterine valve via the placenta, right? So at first we push the baby outside. So the baby is outside. But now we need to push the placenta outside, right? So after the baby is delivered, the placenta is usually delivered within 15 to 30 minutes, right? So after the baby is delivered and we cut the freaking cord, right? Have you seen in movies, after the baby is delivered, they cut the cord. Then the job is not done. You have to wait for the placenta to go outside as well, right? So after the baby is expelled, the placenta is expelled after the baby, right? So when the placenta is expelled, right? If you zoom into this picture, what you can see here is, let me reduce the size of this. So the placenta, this is your uterine wall, right? Uterine wall, right? And this is your freaking placenta, right? So the placenta is actually connected, it is rooted. It's like a tree with its roots inside the uterine wall, right? So placenta it has these roots. I mean, it's not exactly roots, but you can imagine these are these roots, right? So placenta is deeply embedded within the uterine wall, right? So when there is expulsion of this placenta, when the placenta is now expelled, right? When this placenta goes out, right? All these blood vessels, as you can see here, all these vessels that are filled with blood, when this placenta goes out, what will happen to these blood vessels? Now suddenly these blood vessels are leaking, right? So previously there was this placenta. When the placenta goes out, all of this massive amount of bleeding, because this placenta was rooted within the uterine wall, right? So after the expulsion of placenta, what will happen? Because the placenta was deeply rooted, there will be massive bleeding, right? There will be massive bleeding, and believe it or not, this is one of the most important complications in whole of gynae and obs, right? This is known as postpartum hemorrhage, PPH. Postpartum means after delivery, the hemorrhage, right? Postpartum means after delivery, hemorrhage means hemorrhage, blood loss, right? So the blood loss that happens right after the delivery of the baby and the placenta, then there is excessive blood loss, because the placenta literally gets torn apart from the uterine wall. So there is bleeding here, right? So this is known as postpartum hemorrhage, right? So if the hemorrhage is too much, if the PPH is too much, right? If the hemorrhage is too much, then it will obviously threaten the life of the mother, right? Because after delivery, if the mother loses 5 liters, 3 liters, 2 liters of blood, then she will go into shock, right? And it's one of the most common causes of maternal deaths within Bangladesh, right? Or similar developing countries, right? So this is a very important problem. So what the uterus usually does, right? So it happens in normal delivery, right? So the body has its own mechanism to prevent this, right? So what the body does is, right after the expulsion of the baby and the uterus, baby and the placenta, as the placenta is expelled, what the uterus does is it will contract severely, right? So there is, after the expulsion of the uterus, there is severe contraction of the uterus, right? So the uterus contracts very severely, right after the placenta is expelled, the uterus contracts very severely, right? So what is the benefit of uterine contraction after the expulsion, right? So when the uterus, after the baby and the placenta is expelled, there is bleeding blood vessels, right, within the wall of the uterus, right? So when the uterus actually contracts, like severely contracts, what will happen to these blood vessels is, so this was your uterine wall, right? And these were your blood vessels that were leaking, right? They were leaking because the placenta just went out, right? So if the uterine wall contracts, what will happen is there will be increased pressure, because these blood vessels are within the wall of the uterus, right? So when the uterus contracts, the uterine wall also contracts, because it's made out of muscles, like the myometrium, right? So when the uterine wall contracts, there will be increased pressure within these blood vessels. So there will be increased pressure, so inward pressure within these blood vessels. So when these blood vessels are compressed due to severe contraction of the uterus, if a blood vessel is compressed, will it be able to leak blood? No, right? So right after delivery of the placenta, the uterus contracts severely, so that the blood vessels within the wall, they get compressed due to contraction of the myometrium, so that the compressed blood vessel cannot leak anymore. So it will help in stopping the hemorrhage. It will help stop the hemorrhage, right? It will help stop the hemorrhage. So this is your natural phenomenon, right? But again, in some women, right, whose uterus, if the woman is exhausted or the uterus is exhausted, and after the delivery, since, for example, a woman came to you, the delivery happened, the placenta got delivered as well, right after that there's bleeding, right? Usually in a normal woman, this bleeding will be stopped physiologically by the contraction of the uterus, but in some women, their uterus can't contract as well, right? If there's any problem in the contraction of uterus, such as, for example, the labor has been going on for more than 15, 16, 18 hours, right? And the uterus is so exhausted that it does not have any energy to contract. So in this case, since since the uterus is not contracting, which it should be contracting after delivery, there will be increased bleeding, which can lead to PPH. So in this case, we can give what? High dose of oxytocin. High dose of oxytocin, right? So when we give high dose of oxytocin, what happens is I told you that oxytocin causes what? It causes clonic. It causes So it causes clonic type of contraction, right? But in high dose, the contraction it causes in high dose, it can even lead to, like in normal doses, it causes clonic type of contraction, that is contraction and relaxation. But in high doses of oxytocin, it will lead to tonic type of contraction, right? So in high dose, it will lead to tonic type of contraction. And I explained earlier what's the difference between clonic and tonic type of contraction, right? So in high dose of oxytocin, usually oxytocin does clonic type of contraction, but in high dose it causes tonic type of contraction, right? So what's the benefit? If there is tonic type of contraction, right? If there is tonic, severe contraction, constant persistent contraction, right? Then it will do what? Like the normal physiology, if there is severe consistent contraction, then it will compress all the blood vessels that were leaking in the uterine wall, right? So tonic type of contraction is actually good when the delivery process is done. So after the delivery is done, after the placenta has been expelled out, then if we give high dose of oxytocin, then it will lead to tonic type of contraction of the uterus. When because of this tonic contraction of the uterus, all the bleeding blood vessels within the myometrium or the uterine wall, they're going to get compressed due to this contraction. So it will help prevent PPH, or it will stop the bleeding, right? So another use of oxytocin is in high dose, the contraction becomes tonic, hence it can be used in postpartum hemorrhage. So there are two uses of oxytocin. In low or normal dose, this is the normal dose, it is used for induction of labor because it causes clonic type of contraction, right? But in high dose, it becomes tonic contraction. So tonic contraction, it after the delivery, if you give high dose of oxytocin, then it causes tonic contraction and it can be used to stop the bleeding, right? So it can be used in postpartum hemorrhage situation. So I hope you guys understood this, right? This is very important to understand. This knowledge will be useful when we discuss the remaining two as well, right? Now, let me cross this. Now, so that was the use, right? So oxytocin causes clonic type of contraction. The uses is used in induction of labor, and in high doses it can be used since it causes clonic contraction in PPH, right? So what are the adverse effects of oxytocin, right? So in high dose, what can it do? I already told you that in high dose it becomes tonic contraction, right? Tonic type of contraction, right? So the adverse effect is this high dose of oxytocin, it is actually useful in postpartum hemorrhage. But when do we give this oxytocin is very, very important, right? So in order to prevent postpartum hemorrhage situation, we gave oxytocin after the delivery of the freaking fetus, after the delivery of the fetus and the placenta, right? Because the bleeding happens after the delivery of the placenta actually, right? But if you give high dose of oxytocin before the baby is expelled, right, then a disaster might happen, right? So you can give high dose of oxytocin, but only after the baby and then the placenta have been expelled out, to prevent the bleeding. But if you give the oxytocin before the baby has gone outside of the uterus, then what can happen is, in high dose, I told you it causes tonic type of contraction. So it can cause sustained contraction, which can lead to fetal asphyxia due to pressure on the uterine artery, right? So for example, we give the uterus, we mistakenly gave the oxytocin, high dose of oxytocin to the uterus while the fetus is still inside the uterus. Then you know what will happen? So this is your freaking fetus, right? So while the fetus is still inside the uterus, you gave high dose of oxytocin, right? So what will this high dose of oxytocin do? It will cause tonic type of contraction, right? Because we know high dose causes tonic type of contraction. So when there is tonic type of contraction, right, I told you what will happen to the uterine blood vessels. Due to tonic, consistent, persistent contraction, these uterine blood vessels will be squeezed, right? So it's good to squeeze these blood vessels after delivery to prevent the bleeding. But before delivery, these blood vessels are very, very important. Why they are important? Because before the baby has gone outside the uterus, this baby is getting all this nutrition and blood from the mother, right, by the placenta, right? So if you constrict all these blood vessels while the baby is still within the uterus, then all these blood vessels will be constricted. And when all these blood vessels are constricted, will the baby get any blood? No, right? Because you gave high dose of oxytocin while the baby is still within the uterus, it causes tonic contraction. Tonic contraction led to constriction of these blood vessels within the myometrium wall. Due to this constriction of these blood vessels, no blood is now going to the baby, right? No blood is going to the baby. So what will happen to the baby if there is no blood going? The baby can't get oxygen, right? And this can lead to, we call this fetal asphyxia, right? Oh my god, asphyxia, right? So the baby will have acute shortage of oxygen, and this can, if it's prolonged, right, if you don't get oxygen for like, I don't know, 10 minutes, you die, right? So the baby can also die if you're not careful. So high dose of oxytocin can be used. It is actually useful, but you should know when to use it, right? It's very, very important, and I just explained why. So let me just clear it out, it looks really dirty. So one of the potential adverse effect, if you don't know how to use it properly, is that if you give high dose of oxytocin while the baby is still within the uterus, it can lead to fetal asphyxia due to pressure on the uterine artery. It collapses all these arteries, right? I hope that was clear, because it's very important, right? Now, so that is the most important thing about oxytocin, right? I've explained most of the important concepts, right? So other important things are, it is a neuropeptide because it comes from the posterior pituitary, which I explained here at the beginning. It's a neuropeptide because it comes from the nerves and all that, right? It is also known as nonapeptide, right? And you can tell me why is it nonapeptide? It's because there are 9 peptides made out of 9 peptides. That's why it's called 9 peptides or 9 amino acids. I forgot. So just look at it in the books, right? That's why it's called nonapeptide, right? Now, one last thing that I would like to mention regarding oxytocin, which is very important for your exams, is it is sensitive only in the last stages of pregnancy, right? Because the receptors are increased under the influence of estrogen, right? So what is the importance of this point? So the uterus is sensitive to oxytocin only at last stages of pregnancy, like only around 9 months when the delivery is about to happen, right? It is important because, why is it important? Right, it is important because, like in normal human beings, in you and me, right? I mean, I'm a guy, so in guys also there is oxytocin. In females also there is a normal level of oxytocin. So even you, if you're a female watching, if you're a guy, both of you guys have oxytocin in your body, right? So if a female, even though when she is like, I don't know, like 2 months pregnant, she will still have oxytocin in her body, right? But you might think, like, oxytocin causes fetal contraction of the uterus, right? So if I'm saying that there is oxytocin even when the mother is only 2 months pregnant, then won't this oxytocin cause contraction of uterus and expel the baby out prematurely, right? So this is the question, right? So because oxytocin we know is an embolic drug, it causes uterine contraction. If oxytocin is present even when the mother is 2 months pregnant, this might cause uterine contraction and this might lead to abortion, right? But if it was true, then all of us would have been aborted, right? No one would have been born, right? So what the body has a mechanism, right? So the body says the oxytocin receptors are only increased at end stages of pregnancy, right? So that, why is it this way? Because so that you don't get aborted, right? So if the oxytocin receptors are only increased at last stages, I don't know, around end of third trimester, right? And if the oxytocin receptors are only increased at the end of third trimester, then which it's actually this is where you actually need the oxytocin, right? Because at the end of third trimester, that is when you want the baby to go out, right? That is the end of 9 months, right? So that is the importance of this line, right? So I hope I could make it I could stress the importance. So the oxytocin receptors on the uterus are sensitive only at the last stages of pregnancy, and this sensitivity happens under the influence of estrogen. So at the later, around the 9 months, right, around the time when the delivery is expected, there is an increase in estrogen levels, right? And this estrogen causes increase in oxytocin receptors on the uterus. And because of this increase in number of oxytocin receptor, oxytocin that is present in the normal levels in the body, it will have more action on the uterus, which will lead to clonic type of uterine contraction, and which will actually initiate or start the labor process, right? So I hope that is clear, right? So in the later stages of pregnancy, the oxytocin receptor number increases, which helps the oxytocin to contract the uterus and start the labor process. That is when the mother will complain of labor pains, and then she will go to a hospital hopefully and get the normal delivery, which will expel the fetus from the placenta. And that's how, like, everyone, like if you were delivered by a normal delivery, that is how you were born. And if you're delivered by C-section, and I mean that's how you were born in C-section as well, but that's another topic. So if you're born by normal delivery, this is how normal delivery works, right? At the end of around 9 months, the oxytocin receptors increase, and this receptor increase will make the oxytocin that is present in the blood work more on the uterus. That will lead to uterine contraction, which will start the labor process, which will cause the baby to come out of the uterus. That's how oxytocin works. So that is the importance of this line. Oxytocin is sensitive only around the later stages, last stages of pregnancy, right? So that is it for today, and in another class we'll hopefully cover the prostaglandins and the ergometrins. So I hope that was useful. If you would like to get these notes, you can contact me, or I have notes on everything. You can contact me and check out my website. That's it. Bye. Hopefully it was helpful.